Today we are going to present about elbow dislocation and fracture. An elbow dislocation occurs when the forearm bones, which are radius and ulna, shift out of place in relation to the upper arm bone, which is the humerus. An recurrent fracture is a break in the pointy bone of the elbow that sticks out when the arm is being bent, which is actually the end of the ulna. The elbow is located immediately beneath the skin of the elbow, with a little protection provided by muscles or other soft structures. Also, if a person takes a direct blow to the elbow or falls on an outstretched arm, it can easily break. Next, for the global incidence and prevalence, the incidence of elbow dislocation is 6 of every 100,000 adults during their lifetime. The incidence of the injury has been estimated at 2.9 events per 100,000 people of the age of 16. Elbow dislocations constitute 10% to 25% of all injuries to the elbow. The mean age of an individual sustaining this injury is 30 years. There is a male primary dominance with 2 to 2.5 times that of females, with similar ratios seen in children. Approximately 40% of dislocations have a poorly defined mechanism of injury. Moving on to the incidence in Malaysia, children's traumatic elbow dislocations are uncommon, accounting for just 3 to 6% of pediatric elbow injuries. Only a few research on pediatric elbow dislocation have been published, the majority which were case reports including uncommon kinds of dislocations and consequences. The anterior elbow dislocation is uncommon, with less than 2% chance of occurring. Supracondylar fractures occur in 60% of all pediatric fractures, and also, there is no research regarding the incidence of elbow dislocations and fractures for adults in Malaysia.
Now, I'm going to discuss the cause of elbow dislocation and fracture. Dislocation of the elbow are uncommon. When a person falls onto an outstretched hand, their elbow dislocates. The commonly seen posterolateral elbow location is induced by valgus force. The force is transferred to the elbow when the hand hits the ground. This force usually has a rotating motion that can force the elbow out of the socket and rotate it. This can also happen when passengers reach forward to brace for impact in a car collision. As it then falls, the force transmitted through the arm has the potential to dislocate the elbow. Any or all of combat stabilizing action structure can be harmed to varying degrees when an elbow dislocates. A simple dislocation does not result in considerable bone damage, whereas a complicated dislocation might result in serious bone and ligament damage. The blood vessel and nerve that run through the elbow may be affected in the most severe dislocation. There's a chance you will lose your arm if this happens. The most common cause of olecranon fracture is falling on an outstretched arm with the elbow grasped securely to brace against the fall. The tricep muscle, which joined to the olecranon, can pull a fragment of the ulnar bone away in this condition. This type of injury can also result in ligament injuries surrounding the elbow. Other than that, it also can happen by direct strike to the elbow from something hard, such as the dashboard or a car door during a car accident. An elbow dislocation is marked by severe discomfort, swelling, and the inability to flex your arm. You may lose feeling in your hands or lose your pulse in some circumstances because your elbow has arteries and nerves that may have been injured during the dislocation. A whole elbow dislocation is excruciatingly painful and noticeable. The arm will appear malformed with an unusual twist at the elbow. If you have an elbow fracture, you may have moderate to severe pain. The arm is frequently too painful to move. Then there's a sensation of instability in the joint as if it's about to burst out. The arm then becomes tight, stiff, or cramped. Then there is the bruising around the elbow. This bruising can sometimes spread up the arm to the shoulder or down the forearm to the wrist. Then there's catching or grinding sensation near the elbow. The elbow, forearm, wrist, or hand may then become numb. Then there's the softness to touch. It's also possible that the location will be hot. Finally, the bones in the area have an odd shape.
For the pathophysiology, during a posterior elbow dislocation, the shearing forces causing the injury may cause associated radial head, radial neck, or coronary process fracture. The medial collateral ligament and lateral collateral ligament provide support to the elbow joint in addition to its bony anatomy. The LCL is often disrupted when an elbow dislocation occurs. The MCL is the last soft tissue structure injured as the ulna is displaced. Often, the flexor pronator mass may be ruptured and occasionally the brachialis may be injured. The anterior compartment of the elbow surround the brachial artery and ulnar and median nerve. These structures are particularly vulnerable to injury because the anterior compartment is often disrupted during posterior dislocation. The ulnar nerve may be entrapped as it passes posteriorly around the medial epicondyle. The brachial artery and median nerve travel closely to one another, and injuries are often seen in both these structures simultaneously. Anterior dislocation are often associated with olecranon fracture. This dislocation may also disrupt the posterior elbow compartment, which contains the radial nerve and insertion of the tricep muscle. For conservative management, in most cases, the normal alignment of the elbow may be restored in a hospital emergency room. Sedative and pain reliever are frequently used before this procedure. The act of restoring elbow alignment is known as a reduction maneuver. It's done slowly and softly. Simple elbow dislocation are treated by immobilizing the elbow for 1 to 3 weeks in a splint or sling followed by early motion exercises. The capacity to fully move the elbow may be affected if the elbow is held stationary for an extended period of time. During this time of recovery, rehabilitation might be beneficial. Fortunately, even without a complete range of motion, the elbow can perform well. X-ray may be taken periodically while the elbow recovers to ensure that the bones of the elbow joint remain well aligned. For surgical management, surgery is often needed to treat elbow fracture dislocation. If the elbow can be put back in place, the surgery will likely occur after the swelling has gone down. However, if the elbow cannot be put back in place or will not stay in the proper position, surgery will likely be sooner. In surgery, an incision or cut is made over the elbow, the bone are realigned, and metal plate or screw are used to hold the bone together until they heal. The ligaments around the elbow may be repaired to keep the elbow positioned correctly. Occasionally, the head or top of the radius bone cannot be repaired and need to be replaced with a metal piece. After surgery, patient will likely be sent home in a splint, cast or brace. After 7 to 14 days, patient will return for follow-up with their doctor.
Now we will look into the cause and prognosis. For cause of elbow dislocation, the elbow can be managed well by keeping it immobilized for 1 to 3 weeks with exercises to prevent stiffness. Besides, there is also pain and swelling around the elbow during the recovery. For prognosis of elbow dislocation, partial dislocation or subluxation could occur if the ligament does not fully heal. For elbow dislocation that is associated with fracture, it will take a longer recovery time rather than pure dislocation. For certain cases that involve fracture, there is poor outcome after the treatment, such as post-traumatic symptoms and risk of instability. For cause of elbow fracture, the pain of elbow fracture can last 4 weeks. After the injury, the area around the elbow will swell, and the elbow fracture took approximately 6 weeks to heal if get a proper treatment. For prognosis of elbow fracture, children had a better prognosis as they heal much quicker than adults. The recovery also depends on the severity of the fracture. Some may experience stiffness after the cast comes off. If the fracture is left untreated, it could lead to non-union fracture and the pain will be worsened. Now, we will look into the impairments and functional limitation according to ICF. For functional limitation, the patient will have tenderness at the forearm, muscle weakness, lost range of motion, loss of sensation, and has elbow instability. These impairments will lead to limitation to the activities such as self-care activities, work or education, and domestic life. And lastly, the patient will have difficulty to participate in social such as meeting friends and family. Besides, patient also unable to participate in work or school activities as they can't move the arm. And lastly, patient could not participate in recreation such as badminton, as playing badminton requires the upper limb movement.